We're really happy to have this town hall this morning. I want to give you some updates on what's happening in the organization, but like we always do, we start off with something that is important to us, which are common purpose stories. Making a difference from our heart seems particularly important in today's world. As all of you know, we're dealing with a lot of issues and concerns that actually pull against some of our service standards and guiding principles as a culture. Probably the most toughest for us has been that personal connection piece, as we've had to restrict our visitors and our family members from being a part of the care experience that people have needed from us. This actual depiction is one that it really comes to mind as being special, as you could see that even though we've had to live by very tough restrictions, our people have gone above and beyond to make certain that personal connection exists. The gentleman in the wheelchair is a patient who needed open heart surgery. And knowing that their family is obviously very concerned about this patient, our staff went above and beyond to ensure that their family could be here to at least wish that person well. That's a great example of the type of culture that we have in this organization that helps drive us through very tough times. So while we have a policy that says that we have to be careful about how we interact with our patients and customers now, that doesn't mean that we can't put deliberateness into how we do that. And I'm very proud of the fact that we have seen this time and time again through the last several weeks and months. So as we move forward, it brings me to the next issue, which is really one of the real reasons why we wanted to have our town hall today, was to really celebrate our culture. Over the last several years, we've worked really hard to build an organization that's special, to lead by example, and we're very happy to announce that this year, for the 4th year out of 7 years that we've been participating in this study, we are now, again, a top workplace for 2020. So congratulations to all of you. Thank you. So with that announcement, we want to make certain that you understand that that is a result of your engagement with the organization. This award comes in comparison to many others in our Central Ohio region. We actually fit in the large workplace category, which is 350 people and above. So you could see that that bar is set relatively low for large corporations. We're one of the largest, and that gives me a lot of, it gives me a lot of pride that we're able to continually show that we belong in the top of the top. And so congratulations to all of you. We really do appreciate you for all you've done. So Columbus CEO Magazine is publishing that list today. I think of the top 13, we are number 11. We are not going to have a ceremony this year, at least not in the current moment, along with everything else social that is being canceled. So we wanted to make certain that you knew about this. We have badge placeholders for you, so make sure your leaders give those to you. Put them on with pride. You deserve them. Very well, very, very strongly deserved accomplishment. Congratulations. Just in terms of some other updates to the organization, I think it's very fair to share with you what's been going on. COVID-wise, we've seen our fair number of patients. We've done quite a bit of testing. We are not seeing a massive surge, thank God. We are very appreciative for the fact that we have not been overwhelmed in our community and in our organization. But we have had a fair number of patients that have come here looking for help. We use a variety of different testing facilities, and some have done a really good job of stepping up and helping us manage our population very, very well. This is going to be an ongoing issue, as there's a demand for more testing for people wanting to get back into the workforce, to make sure that we know what's going on. The testing issue is one that's still very, very prominent to us. We've seen a little bit of an upward bump the last few days. And Dr. Murray's explained it as maybe the Easter effect. People congregated maybe where they shouldn't have, maybe as much. But also, as the government opens us back up for business, we anticipate to see periodically some ebbs and flows to the number of patients that we see here. We are doing this exceedingly well. I'm very proud of our organization, how we've re-engineered ourselves to be COVID ready. The folks in our observation unit are handling these patients as they would any other patients with an acuity that represents a similar type of need. Intensive care has done a great job. All of the folks involved have just done a great job to turn this organization to one that has met our demand and met the need that we've been asked to meet. As far as safety precautions go, as I explained earlier, we have upped our game quite a bit in terms of trying to protect ourselves and our patients from COVID-19. We now have heightened our visitor restrictions, as I've mentioned, but we've also increased the frequency of cleaning and disinfection. One of the things that we have seen is we have seen a fairly significant downturn in volume because of COVID-19. Not specifically because of the things that we've been asked not to do, but there's also been a general reduction of use of our emergency department and our inpatient units. We'll talk about what that impact has been later, but what I want to share with you is that we've taken the opportunity to go back into our organization and really hit some areas hard that we just traditionally have not had the chance to. We always keep them clean, but we've had a chance to go back and make them super clean. And so we're really pleased to say that we've used every opportunity we can to prepare this organization to come out of COVID-19 and to give the community and all of you the comfort that we are a very clean and very safe environment. The observance of social distancing measures continues, and we're looking at how we're going to have to come out of this and manage to social distancing. Things that were okay before are not going to be okay moving forward. So we're looking at things like waiting rooms, we're looking at process, we're looking at how do we keep people safe as we work out of a very tight, restrictive environment. It's very important that we do that very carefully but very cognitively to what customers feel comfortable with and what's safe and prudent. So that's an ongoing issue that will not go away anytime soon. As I mentioned, mandatory use of face masks and face coverings for all outpatient visitors and team members. Again, remember too, and one of the reasons why I started this presentation with the little caveat that I did is that, you know, when you're in offstage places where you can be socially isolated, you can breathe normally, but when you're out amongst our customers and particularly out in public, please, you know, wear your masks. Be safe, wash your hands before and after you put your masks on and off. Use the disposable bags to keep them safe. Keep yourself safe. We need you healthy. And that's really what this is about. It's taking every precaution we can to keep you healthy. Our public gathering areas are going to remain closed until either we're given the mandate to open them, and then even when we do, we're going to be looking at making sure that they are safe under new social distancing. We have to make certain that we rethink how we do business for things that matter to us. In the meantime, places like our cafeteria are still open for food items. I think we've done an amazing job of trying to repurpose our cafe to be user-friendly and to help where it can. And so we're going to continue to make sure that those types of things continue. We're going to continue with the widespread temperature screenings upon entrance of all FMC facilities. That isn't going to be going away anytime soon. It's a very proactive measure to ensure that all of us stay healthy. And so hopefully you've gotten used to it. I don't think it's been too obtrusive. It hasn't obviously caused too many backlogs or problems. So it's something we're going to continue to incorporate into our daily lives. We're going to continue to cancel any community and internal events and non-essential meetings. Again, we congregating is as bad as you congregating out in public. So we're trying to make sure that when we do have meetings, that we can use virtual meetings where possible, that we're trying to be sensitive to the time that we spend together, the distance we spend together. Keeping ourselves healthy is a very, very critical issue because if we don't stay healthy, our community suffers, your family suffer, and that's not what we want. So we're going to continue to maintain some type of pause with community and internal events. And we're obviously using telehealth. Telehealth is something that has been recently freed up a little bit more, and it's actually been a very, very good tool for our patients and our physicians. They're actually, in some cases, been able to much more efficiently and empathetically care for our patients. So we're going to continue to use telehealth to our advantage, and it's an emerging thing. I think one thing that will come out of COVID-19 is that telehealth is here to stay, and I think it's a good thing. So anything we can do to help reach more people in a more efficient way and provide them good care is a great thing. Elective procedures. This ties back to an order that just came from the governor's office today. The governor issued his Restart Ohio order, and the way that we're involved in this is that actually the governor's leaned on healthcare very hard to say, how do we do this smartly? I think for all the gains that we've made in the last month and a half in terms of flattening the curve and keeping people healthy, the concern is if we start too quickly and we allow too much to happen too soon, we're going to end up in a bad situation. So healthcare in general across the state has been very involved in this. So as of Monday, May 4th, actually as of today, May 1st, the governor's lifted restrictions on some forms of non-emergent surgery, not all. And this is going to be a metered and a graduated increase in business over time for us. It's not just the floodgates open. So we'll responsibly return to outpatient surgeries and procedures beginning Monday, May 4th. We're very excited about that. We have, it's nice to have a full surgery schedule, and we're going to be doing this in a little bit of a different way to help our community get over some of the COVID-19 issues that have come up. We want to make sure that this does not include procedures that require an overnight stay. That's one of the governor's asks, is that we want to make sure that these are same-day surgeries, in and out, quick, good experience, fits the standard of care, but that does limit somewhat the number of outpatient procedures that we will do. And we're going to feature our Riverview Surgery Center to be the place where those things occur. And there's a lot of logic to that. A, it was built for outpatient surgery, obviously, but it's also a place that's been relatively closed throughout this COVID-19 situation. So it offers our community a place where they could come and get the care that they need that isn't the hospital. I think there's the stigma that the hospital is the place where all COVID lives, and that's really not the case. So we keep the hospital clean, but we also, through practice and through experience, now get to connect to our community in a way that they could go and say, hey, I had my procedure done at Fairfield, I was treated well, it worked well, and I'm fine. And I think that through word of mouth, particularly in our community, it will help us start to see a resurgence of our business as we know it. We're actively monitoring this practice to ensure safety of all of our patients and staff, meaning that social distancing will still continue even in this process. We're working on pickup and drop-offs. How do we make this work so family members can be, again, part of the process to take care of their loved ones, but to make it a clear, efficient process. Again, we've been working on this. We've been anticipating this for about a week. I'm sure we'll learn a lot on Monday because this is not going to be just going back to the way it was. We've had great collaboration and support from our surgeons and our physicians and our staff, and it's good to get some of these folks back to work and doing the things that they're here to do. So Ensemble, if you remember my last town hall meetings, we talked about Ensemble. Ensemble is the revenue company that we're going to be working with to actually manage our revenue structure. That agreement is complete. We completed it, and Ensemble will officially begin the full transition will occur in June. Ensemble will be on site as soon as this month to start providing some services in that transition. But one of the major things that has been focused on over the last several weeks has been the transition of our staff. Our staff have interviewed for positions with Ensemble. I will tell you, the reality is that for the numbers of positions that we've had, not every one of our FMC family members is going to be offered a position with Ensemble, and that's a hard issue for us. But part of the construct here is that the same economic concerns that have impacted all of us as an industry have impacted Ensemble. So as we go into this post-COVID-19 world, this is a tough issue for us. So it does mute the fact that we always strive to keep our organization whole. Unfortunately, though, in order for us to move forward as an organization and have the best fighting chance we can to come out of COVID with a good cash flow and to make sure that we have good finances underneath us, Ensemble has to happen now. It can't wait. This can't wait till everything feels better. It's that important to our success. So I just wanted to be very upfront about it. I feel I'm very torn by the fact that not all of our FMC family members are going to have a landing spot with Ensemble. That breaks my heart. But right now, we are trying to do the best we can to keep this organization moving forward and doing the things it needs to do so that we're here for the next 100 years for our community. And that's probably the thing that helps me understand this a little bit more clearly. It's the right decision for our revenue integrity of our organization. Ensemble is a great company. And I think we have seen through this transition that they've tried really hard to put their best foot forward to be a good long-term partner for this organization. I've been impressed, and I think that in generalities, they really do care about making that good connection. And I'm hopeful that within a very short period of time, we view them no differently than we do our emergency room physicians and our biomed folks. They're just part of our family. We don't think about them in terms of whose company people belong to. The folks that are going to be working with Ensemble that have been part of FMC are still part of FMC, and I want to be clear about that. It's just a very tough transition at a very tough time in our nation's history. One of the things that we are offering and we continue to offer, and I will tell you, is available to anyone who needs it as a result of some of these economically trying times, is our Employee Assistance Program. There's a lot of information on the screen about how that money can be used, paying bills, expenses for groceries, rent, whatever. If you have someone or you know someone or you need help, please don't be too proud to ask. This fund has been created and is available to all of us to make certain that we can get through this in one piece. You know, this is a very, very trying economic time for many people. There's going to be a lot of people whose businesses just don't survive COVID-19, and we have to be sensitive to that. So anything you can do to help make sure that, you know, we get people to this fund if they need it, please do. Contact information is on the screen. There's a form that needs to be filled out, or you could get a hold of Abby Mulholland, and we'll make certain that we help anyone we can. It's not a matter of funds. The funds are there to help. Please use them. And last but not least, I just want to tell you that your dedication and hard work don't go unnoticed. I've seen this organization do some amazing things over this last several months. Actually, over the last 5 years, I've seen this organization transition itself into something that is really remarkable. You know, I've had the pleasure of sitting on, it's really not a pleasure, I've had the opportunity, I should say, to sit on many, many calls with many, many CEOs from across the state who are talking about their organizations and the impacts that they're going through. And when I hear them talk about their organizations, what I don't hear sometimes is the pride that they have and the confidence they have in making certain that their people are well cared for and that they're doing the right things for their community. I hear them talking about stuff, but I don't hear them talking about their mission. I see that every day here. I see you guys really putting your best efforts out there to see FMC survive, see our community prosper, and to get through this. We've had a lot thrown at us, and you know, it seems like it's relentless. When we get through one major challenge, we walk into another one, but that's what we're here for. And so I just want you to know that you're very much appreciated. We are going to finish up with something that I think is very, very special. It's a chance for you to see a little bit of a clip of what your community thinks about all of you. So on behalf of myself, our leadership team, thank you for your time. If you have any questions, please feel free to reach out to me. Thanks.
Hello, this is David Scheffler, Mayor of the City of Lancaster. I'd like to pass on a huge city thank you to all of the staff and volunteers at Fairfield Medical Center.
Team FMC, you guys are amazing. Thank you for what you're doing for all of us and keeping us safe.
Thank you, Aunt Lisa, and all the medical workers out there. We support you and love you.
Thank you for your dedication, and also thank you for your sacrifice.
I would like to take this time to thank the entire Fairfield Medical Center staff for all the hard work and dedication.
Thank you for all you do to keep us safe.
Thank you for everything you're doing during these tough times, and our prayers are with you and your family.
Thank you for the important work that you're doing.
Thank you for your services on the front line during this time and your work within our community.
You show up every day not knowing what you'll encounter, displaying an amazing amount of human courage.
We appreciate the fact that you're risking your health to care for our community.
We're sending blessings and thank yous to all of you working the front lines and behind the scenes.
You are our heroes.
A huge thank you to all the doctors and the nurses and the technicians and the people that work in the kitchen and the cleaning people and the administration. Thank you all. You are all heroes in our community.
I'm truly grateful for all the members of the Fairfield Medical Center team, and I want to thank you from the bottom of my heart. So stay safe, stay healthy, and together we'll get through this because of you.
You are everything in being there for the residents of Fairfield County.
I appreciate the sacrifices that you and your families are making during this time.
Thank you for what you do for our families and our community.
Thank you for everything that you're doing to keep our communities and families safe. This is Xander. He thanks you too.
Thank you for caring for our community during these unprecedented times.
Thank you to all the healthcare workers that are still continuing to work.
Big thank you to all the healthcare workers out there.
Thanks for your circle of support in our community.
Thank you to each and every team member of Fairfield Medical Center.
Just wanted to express our incredibly deep appreciation for everything you're doing and the sacrifices you're making. Thank you.
You all are making such an amazing difference in our community, but more than that, you're making people feel safe.
I'd like to thank all the workers at Fairfield Medical Center, for coming in every day and risking your lives for all the people that you're caring for.
We would like to thank all the first responders at FMC who are facing and battling this pandemic. We appreciate all that you do.
From the bottom of my heart, I say thank you for your time, your energy, your service, and
your selflessness.
Stay Ohio strong. I realize that we're in the first quarter or maybe the most dangerous game in our lives, and you're there for us, and we appreciate it.
Thank you for everything you do.
Stay safe, and God bless you all.
Thank you for all that you are doing, and thank you for being heroes.
Thank you for keeping us safe. Thank you for keeping us safe.
We appreciate all that you do for us.
Keep up the important work, and we will all get through this because of people like you. Thank you.
Your efforts are truly making a difference in our community. Thank you.
On behalf of all the people of Fairfield County, to all of you at Fairfield Medical Center, to say thank you. The work you're doing is greatly appreciated, more than you'll probably ever know. You are our heroes. Thank you.
We're all in this together, and hopefully we're starting to see a light at the end of the tunnel. Keep up the good work.